Mr. Chair, ladies and gentlemen, first I would like to express my sincere thanks and gratitude for the kind invitation to be part of this highly reputable meeting. This is Khartoum, Sudan, and this is the junction between the White Nile and the Blue Nile. My name is Professor Fahal. I am a professor of surgery, University of Khartoum, director of the Mycetoma Research Center, a WHO collaborating center on mycetoma. I declare no conflict of interest in this presentation. All images were taken after informed written consent from the patients or the relatives. I'm going to talk about mycetoma, case management and surveillance. The main objective of this presentation is to share the Mycetoma Research Center experience on case management and surveillance. During the coming few minutes, I'm going to talk about mycetoma as a neglected tropical disease, some of the MRC activities in case management and surveillance, and to share with you some take-home messages. For those who may not be able to stay to the end of the presentation, I would like to conclude by saying at the MRC, we are dealing with a unique disease, the mycetoma, unique patients. These patients has unique problems, and hence we need to come with a unique solution helping these patients. Another important conclusion, I will conclude my talk by saying currently there is no control or preventive programs for mycetoma, and early case detection and management and surveillance, this is the available tools to reduce the disease burden. Again, I would like to conclude by saying that mycetoma is a scar in the human conscious, and our job is to heal it as it is one of the non-glorious diseases. Ladies and gentlemen, mycetoma is a chronic granulomatous inflammatory disease characterized by massive deformities, destructions, and stigma. It has many morbidities and can be fatal. As you can see, mycetoma is a disfiguring, mutilating medical problem, has many morbidities, and can be fatal, as in this patient with intracranial spread of the mycetoma. An important unique feature of mycetoma patients is the late presentation with massive disease, and the cause is multifactorial. Mycetoma frequently affects young adults, the most active member of the society. 30% of our patients are children, and this has many impacts on the patients and the family and the society. Mycetoma usually affects the poorest of the poor in poor remote communities. Most of these patients are of low socioeconomic status, and you can see here this young lady coming to the Mycetoma Center at Khartoum with this vehicle. One of the important characteristics of the mycetoma patient is their low health education level. Many of them depend on the local traditional treatment for quite a time, with all its complications, and when they come late with massive complications of the local traditional treatment. Mycetoma has many social and economic burdens on patients, families, communities, and the health system at the endemic areas. You can see here, these are 4 members of one family in endemic area ended in amputation. And amputation is still in underdeveloped countries a social stigma. Mycetoma enjoys all the anti-these characteristics: social problems, work problems, lack of education, and drop of education. In fact, it is a social stigma. The journey of the Mycetoma Center was established in 1991 with very clear vision and objectives. And the objectives are to provide the patients with high quality treatment, a super research and development activities, to be engaged in the community with active objective activities, and to have a good objective teaching and learning activities. And case management and surveillance is important and integral part of the Mycetoma objectives. Currently, we have almost 10,000 patients registered with the Mycetoma Research Center. We receive patients with advanced disease as the Mycetoma Center is a tertiary center. And many of them, as they present late, they end in amputation, and that is not a very good outcome. So early case detection and management will reduce such a presentation. At the Mycetoma Center, we carried out a lot of activities for case management and surveillance. We started with 2 peripheral satellite units at White Nile and Sennar State for early case detection and management of the patient locally at their villages. We had a lot of field surveys for early case detection and management. Further on, we have a lot of environmental conditions to improve the quality of life of these patients. We established the Mycetoma Friend Association to help these patients with a lot of social and economical support. A lot of health education activities and events are taking place in these villages. All these activities done under the umbrella of the research and development background. Furthermore, for early case detection, we need to have a lot of awareness, and here we're engaged with many fine artists, comedians, and celebrities to help the Mycetoma Center to execute its function. We have a lot of social activities. We appointed some Mycetoma ambassadors. We established the Mycetoma Vocational and Entrepreneurship Training Center, helping these patients and the families, and we are engaged in a lot of social media activities. We established 2 centers, one in White Nile State and the other one is at Sennar State, and we are in the process to establish a 3rd center at the Jazeera. This is what UNSA Mycetoma Center for Early Case Detection and Management, done in collaboration with the Ministry of Health at Sennar State. This is our mission. The whole staff of the center, they go to the villages where Mycetoma is endemic, doing a lot of activities there. We take with us all our consumables, medicines, and other equipment to do the surgery in the field, helping these patients there. During rainy season, it is very difficult for the mission to execute its function, and some of the patients, they cannot come to the village where the center is there. We did more than 1,000 surgical operations in the field, again for early case detection and management of these patients. With a mobile ultrasound, we managed to do more than 1,500 ultrasound examination free of charge for these patients. And this is some of the patients at the post-operative period. They're having surgery, medication, and they will be discharged for follow-up at the local clinic. Now with these missions, we are seeing only patients with small lesions and early duration. And the population are very grateful for the work we are doing for them there. After we leave, we manage to follow up these patients through our telemedicine facility in the village. We have staff there, and the staff at Khartoum, they communicate dealing with the post-operative care of these patients. We did a lot of field surveys for early case detection and management, health education, and some socio-economic support for the patients and their families. We started this mission and these surveys as early as the 1994. This is a field survey for early case detection. We start by clinical examination for any suspected mass, and suspected patients were seen, and through a CABI, this is a computerized patient detector, electronic a questionnaire. During these surveys, you do a lot of health education sessions as a group or as a mass communication. We go to schools, talking to the student, and ask them to report early with any lesion in the body. The health education take different form: a focus group discussion with a group of family members in the village, or house-to-house survey and health education sessions. We usually involve with us some artists. They go to classes, and in the classes they do a lot of activities, doing drawing, talking to the pupils and the students. And some of them they do open theater activity to encourage the young chaps and the children to come forward for treatment and management. The Mycetoma Research Center is involved in the National Program for Mycetoma Control. For that, we produce a lot of posters, paints, and drawing to enhance the awareness of the population about mycetoma as part of the early engagement with the community. We are having a good presence at the different social media. With this activity, now we are seeing patients coming with early lesion, a small lesion as in this photo. We established the Mycetoma Patients Support Association, helping patients, helping communities for early case detection and management. Ladies and gentlemen, I would like to share with you some of our experience and take-home messages. We need to have a clear vision, smart objectives, logical methodology, and good communication, so as we can come with a unique solution for mycetoma, as currently there is no control or preventive program. We need to work together with other entities so as we can share resources and reduce expenses and have a proper outcome for these field surveys and activities. And thank you very much for your kind attention.